The health department warns that it is possible for active COVID-19 cases in the country to reach over 400,000 by the end of April if the government will not impose stricter measures. Greg Gregorio joins us live from Mandaluyong to tell us more about this. Greg, with this statement, are we looking at the situation wherein ECQ will be extended after this week? What are we looking at here?
Charles, according to the Department of Health, they are not disregarding the possibility of either extending or lifting the current implementation of enhanced community quarantine over NCR and other neighboring areas. Health Undersecretary Maria Rosario Vergara said the government will be basing their decision to some indicators, and this include the lower hospital care utilization rate over the National Capital Region as well as over the whole country. Charles?
Right, Greg, talking about the healthcare system, how is it holding up as of today? Do we still have enough hospital beds, ICU beds to service patients?
Charles, according to Undersecretary Vergara, the hospital care utilization rate for the whole country is at around 63%, while it is 73% for the National Capital Region. And Vergara admitted that we are choking when it comes to the utilization of ICU beds, especially in the high-risk areas. Thus, the government is targeting to lower the hospital care utilization rate by after a week of these enhanced community quarantine. Charles?
Yeah, Greg, so what exactly is causing this choking, and how's the government planning to address this lack of beds and medical personnel for COVID patients?
Plus, according to the Department of Health, when they have audited the hospitals, they've seen that 41% of the admitted patients for COVID-19 are asymptomatic and mild cases. And Vergara said that these patients should only be admitted in step-down care facilities like the temporary treatment and monitoring facilities. Thus, the government is also building additional beds, which they say will be available by April 8th. And as to the question on the lack of medical workers in healthcare facilities, Vergara said that there are measures in place to augment the medical workforce in facilities, and this include the continuous hiring of medical workers and tapping the uniformed personnel of the Armed Forces of the Philippines for their medical offices, for their medical officials to augment the medical workforce in facilities. Charles?
Right. How about the government's vaccination program, Greg? Do we have any significant updates as of today?
Plus, according to Vergara, 80% of the distributed supply of the vaccines that we currently have is around 1.1 million doses of COVID-19 vaccines. 80% have been inoculated already. But the Department of Health is now calling for all medical workers, even those that are not directly giving care to COVID-19 patients, including those under other medical societies like the Dental Society, for them to have themselves registered for the inoculation until March 31. And while doing this, the department is now planning to do a simultaneous vaccination for the senior citizens and people with comorbidities.